Welcome to ScoliTalk. I am so excited today to be interviewing Dr. Mark Morningstar here at ScoliSMART Michigan. Dr. Morningstar is a ScoliSMART doctor, president of the International Chiropractic Scoliosis Board, and developer of the ScoliSMART Activity Suit. So thank you for being
Thank you for coming out on this wonderful snowy day.
Oh my gosh, it is. There's like a winter weather advisory.
Yes, indeed.
So I read that out of high school you actually wanted to be an orthodontist.
This is true.
How are you here today treating scoliosis patients?
Well, when I was a kid, I had braces, I swear, for most of my teenage years. And so I pretty much lived in my orthodontist's office. And so it just kind of became a natural thing. And I didn't know what else I wanted to do. So when I went to college, I thought, well, I'll be an orthodontist because I already kind of see what they do day to day. I spent every 6 weeks in his office for 6-7 years, something like that. So it was kind of second nature. And my senior year in undergrad, I actually started working for a moving company, and I hurt my back lifting a piano down a flight of stairs with somebody. And the person above let go of it, and I had to kind of hold the whole thing, hurt my back.
Oh my gosh.
Well, lo and behold, there was a chiropractor locally that, because it was a work injury, they made me go see, and I had never been to a chiropractor. And he worked on me, and after 2-3 times of seeing him, I was able to go back to work again, and I was fine. And out of sheer curiosity, because you have to understand, I grew up in a town where chiropractors are all quacks, and
right.
All they do is hurt people and so forth. So out of sheer curiosity, I asked him if I could follow him and kind of shadow him. And the very first day that I was there, he was working on a woman who was having migraines so bad that she had to wear glasses. And this was maybe, I think, her 4th or 5th treatment with him. And I happened to observe, and he worked on her, and she took her glasses off and looked at me right in the eye and said, "This man is God." And I thought, this is what I want to do.
Wow.
It was like somebody looks right into your soul, and it was just like, okay, I got the hint. This is what I need to do. Yeah, that was it from there. And but what was nice was going from pre-dental to pre-chiropractic, everything was identical. Mm-hmm. And so it was easy then to just switch and go about a different path.
Oh, awesome.
So,
well, I'm sure I'm speaking for a lot of people when I say we are glad that you're helping straighten spines instead of straighten teeth.
Well, I'm glad too, because I had this sinking feeling my senior year in high school, where my senior English teacher's husband was a dentist in town, and he had a nervous breakdown,
really?
Which is apparently very common among dentists. And she, in the middle of class, had a nervous breakdown because he had a nervous breakdown. I thought,
my gosh.
Wow, dude, is this really what I want to do? But again, at that time, I didn't have a better idea, so I thought, well, I'm just going to stay with it because it's what I know. And so thankfully, yes, I'm not in that profession either. But I'd much rather help a whole person than just their teeth. So
yeah, well, we're pretty thankful for it too. So I recently purchased your book. Dr. Morningstar wrote a book called Scoliosis and ARC 3D Therapy, Restoring Hope with Non-Surgical Treatment. I really liked something that you said in your book. You said it is vital for all patients who are diagnosed with any chronic disease to fully understand and appreciate the complexity of the disease. Having this knowledge empowers patients to make better, more informed decisions regarding treatment. So I really liked that. Is that what inspired you to write the book?
Essentially, yeah. What's interesting is there was a study published by ScoliSMART, which is an entire educational body on the non-surgical treatment of scoliosis. And they interviewed all of their membership body, orthotists, chiropractors, PTs, orthopedic surgeons, and physical medicine doctors. And they created a list of all of the most important things to shoot for in managing a person with scoliosis. And interestingly, you might think, Cobb angle is number one and all these types of things, but actually among the top 5 things that were the most important one of them was deemed just knowledge of the condition. And especially present day, I think now more than ever with the way a lot of the research is coming out, the scoliosis is really kind of being redefined as a condition that's not so much the curvature being the primary deformity, but rather the primary symptom of an overall problem. And I think especially when parents first just get hit with the reality that, oh my gosh, my son or daughter has scoliosis and now they're telling me she needs surgery or so on, they really never have time to kind of delve into that. And there's so much information available now on a lot of these underlying things that allowed the curve to happen in the first place that it really, in my mind, behooves me as a practitioner to inform parents that that information is even out there, because most of the time they don't know. Mm-hmm. And by the time they end up doing a phone consult with me or something like that, and we start talking about neurotransmitter imbalances, hormone signaling imbalances, bone density issues, they think all this stuff's coming out of left field, and this is the first time most of them have heard about these things. And then most of this is not information that we've published. This is information that's freely available worldwide, mostly by international researchers. And we're just taking advantage of the information and actually applying it to the management of that person. The real problem I think we have treatment-wise, especially in the United States, is that they don't take the updated information and apply it to the way we practice collectively. They'll say, okay, great, there's a genetic aspect or whatever, but it doesn't change the exercises they're doing, or it doesn't change the type of surgery they're doing, or the bracing that they're using. So we really need to get to a point where, rather than focusing on the treatment of scoliosis, a lot of the information that's out now can be about, let's focus on the prevention of scoliosis and not the treatment of it.
Mm-hmm. I like that. I think, just growing up and not having any options, and knowing now what's available, I just think it's amazing what is happening,
Sure.
as far
and a
as,
lot of it is relatively recently. And we're talking the last 6 to 10 years, really, a lot of this has come out.
Yeah, and just to know that someone's working on that, it makes me happy knowing that other teenagers and kids are going to have to go through what some of us adults are going through or have gone through now. Mm-hmm. So, just,
for sure.
It's awesome. Let's see. So you developed the Scoliosis Activity Suit, or ScoliSMART Activity Suit as it's called. That wasn't its original name. Can you tell us a little bit about the development of the suit, how it came about?
Yeah, so the suit's been now around for going on 10 years here, coming on. And way back when, back in 2006, I attended a ScoliSMART meeting in Poznan, Poland. And one of the big things that a lot of the physical therapists were doing in Poland was kinesiotaping for scoliosis.
Okay.
And where they would literally take the kinesiotape and wrap it around the torso and attach it down onto the legs or even all the way down into the knee or ankle. And so I learned all that, thought it was very fascinating, because in Poland, obviously it's a poor country, so a lot of the patients didn't have a whole lot of options treatment-wise from a financial perspective. Mm-hmm. So a lot of the PTs had to be very low-tech in a lot of the things they were trying to use. And so, needless to say, I had already been certified in kinesiotaping prior to that. I just never knew how to apply it to scoliosis. And so, we came back here, I started instantly playing with it on my scoliosis patients, and it worked incredibly well. But the problem we ran into is that as you repeatedly apply that tape to the same patient, their skin can start to become sensitized to it. And then now they start getting a rash from the tape, from the adhesive on the tape and things like that. Mm. And you can only do that for so long. And once they start reacting to the tape, in some cases you can't ever reapply it. Oh, wow. So from there I said, how can we take this same wrapping concept and use it in such a way that the person never has to have a problem with it? Or they don't have to wear it on their skin in case they do react. Or if their skin is very frail, the adhesive on that tape is so strong, sometimes it would break the skin. And so you gotta, especially in adult patients, have to be careful with the tape. And so that's where the suit came along. I actually, I don't know if Dr. Clayton Stitzel will remember this or not, but he and I were at a meeting literally a year later, ScoliSMART meeting, and I drew out the prototype of this to him and said, this is based on the kinesiotaping that we've been doing, and this is what I want to do. And at first we called it the tornado suit because this was designed for kids. And I didn't want kids to have to deal with the stigma of thinking it was a scoliosis something or other. Most kids are very self-conscious of it, understandably.
Definitely.
And so most kids thought the name tornado suit was very cool. Almost kind of made them like a superhero or something. But the problem we ran into is that there's actually, believe it or not, a motorcycle suit called a tornado suit.
Who knew?
And go figure. And so obviously we changed it from there. But interestingly now, the ratio of the patients who use it in total has really almost flip-flopped. When I first began using it for the first 3 or 4 years, it was probably 90% kids using it. And by present day now, it's probably 60% adults using it.
Wow.
So it's entirely changed over. And the reason I think is because adults are typically the ones who have pain. A lot of kids, even with bigger curves, don't have pain right away. And adults, pain is the primary motive for them coming in for treatment. So with the suit, even if we weren't getting significant curve changes right away, as we were first kind of learning about the suit ourselves, we were finding that they were getting significant pain improvements on a very rapid basis. And so that in and of itself was enough for them to start saying, hey, look, I don't care what my curve looks like on an x-ray. All I know is now I can clean my house, I can play with my kids, I can live life again.
Exactly.
And to me, that's far more important than what anybody looks like on an x-ray. So.
Yeah, definitely. And now it's an activity suit. And so sometimes you hear people refer to it, as a brace, which it's not. Can you explain the difference?
Yeah. So with a brace, of course, the brace does all the work for you. It's a hard urethane plastic brace. It forces you into position and it keeps you there. And the problem is, even in adults, if you wear it long enough, you start to undergo deconditioning. And then you become reliant on the brace. And it doesn't matter if it's a scoliosis brace or a knee brace, ankle brace, any of those. If you wear them for too long, the muscles in the joint weaken. With the suit, as anybody who has worn one can attest to, the suit actually increases muscle activity. It doesn't decrease it.
Okay, yep.
And it forces you to have to work against the suit. And we put the suit on in such a way that it actually aggravates the rotational pattern of your curve so that your body has to fight against your curve. And over the course of time, as that muscle activation continually occurs, as you're doing your normal daily activities, the suit essentially reprograms the way you do those things from a muscle memory perspective, but not in a conscious way. The idea is the body strives, our brain has this need almost to put things on autopilot. Whether it's sitting at the same spot at the dinner table every night, or going the same exact way to work every day, or whatever, your brain wants to autopilot everything. And your brain autopilots postural control and movement. So we have to change postural control under that same autopilot mechanism, as opposed to trying to get people to consciously do a certain thing. Because then you're not engaging the same system. And with the suit on, consciously you're continuing to go about your normal day. You're cleaning your house, you're doing homework, you're having dinner, walking your dog, whatever you're doing. And as long as you're doing all those normal things, the suit is making everything else automated. And your brain likes that. And that's why the changes occur so consistently from the suit, especially in adults, because we can predict based on their curve pattern how to put the suit on and then get the brain to react.
Gotcha.
So very, very fascinating.
Yeah. So I understand it kind of brings a scoliosis patient out of the postural collapse, which is pretty pain relieving.
For sure. So, and that there are a couple different aspects of the suit. So the base pieces of the suit are kind of the anti-postural collapse, like you mentioned. Just to kind of, so for example, especially in somebody who has a curve above 50 degrees, they have so much compression on their spine that gravity just keeps aggravating that over the course of a day. And so what the suit does is it shortens that lever arm so that it gives those postural muscles better endurance throughout the day. And it takes longer for that same level of postural collapse to occur. Then at the same time, we have the straps that wrap around the torso, which are really the bulk of the work, because now the torso muscles have to react to those straps. But because the base pieces create more verticality in the spine, those muscles that have to resist those straps now have a better mechanical advantage from which to work. And so they can cause more derotation as a byproduct.
Nice. Perfect. How can someone know that they're a good candidate for the suit?
Well, for an adult patient, that's a good question. I think most people are a good candidate. I think really the only question becomes how much of a benefit can it provide. So, obviously, optimally, if possible, People, if they have scoliosis, and especially if that scoliosis is causing them pain, I would recommend that they do a trial fitting. We do them here very regularly, and the idea is if we can tell right away that it's making a difference, and most people, even the people that were here today, could tell pretty immediately that it was making a change. And we expect that to occur. And if it doesn't, then it may not ever produce a change for them. Not to mention that we can also do an x-ray while they're wearing it to see some of the curve changes right away. There are instances where when somebody puts a suit on, their curve measurements can get worse right away. And then maybe it's not such a good idea for that particular individual to have it. But in instances where, for example, a patient has already had spinal fusion surgery for scoliosis, most of them actually do quite well. And they don't typically need x-rays other than to identify their curve pattern. But we're not expecting dramatic changes because they're fused. But the suit does a very good job in people who are fused with their pain relief and their functional level.
Exactly, and that's important.
And that's their main goal. Most adults would say that.
And I have a lot of parents who actually ask me about the suit for their teenager. So can you explain the difference in the use of the suit with teenagers versus adults?
Sure. So in an adult patient, obviously an adult is skeletally mature. So with that means that an adult is typically going to have his or her full adult muscle strength. The adult I don't have to worry about the adult growing, 2-3 inches in the next so many months or weeks. So all that's behind them. And because of that, the treatment or the suit works on a much more straightforward basis. In children, the problem we run into is that they have growth spurts. Their flexibility constantly changes. Their muscle strength constantly changes. They have periods of time where they have less coordination as they grow. So they have a lot of factors to come into account that make them at times better or less able to react to the suit.
And so teenagers, would you have to maybe adjust their setup throughout the time?
So what happens a lot of times is in the setup of a suit for a child, in many cases the tension bands have to be changed sometimes in every 2 or 3 months. Now typically the base pieces are the same for a child as they would be for an adult, but the way we have to introduce the rotation has to be modified based on their ability to react to it. In a lot of younger children, and even in here in our own office, I can't speak for all offices, but I would say out of every 10 children that we test for a suit, at least half of them fail the test the first go around. And it's because they physically don't have the muscle coordination to react to the suit correctly. And maybe some of that's muscle weakness, maybe some of that is a coordination time when they're right before or during a growth spurt. But a lot of them fail right away. And it takes going through different rehab, or we do ScoliSMART boot camp and things. Once they get some of that behind them and they get sort of on the back end of their bone growth, then they can start to have enough muscle reaction that then the suit works better for them.
Okay. And so do you use the suit only for teenagers or kids in combination with the rehab?
For sure. It has to be, just because we have to be able to follow up with them more frequently.
Yeah,
sure.
That makes sense. So in the last 10 or 15 years, how has scoliosis treatment options changed? And in your opinion, will advancements continue to be made?
Well, last 10 or 15 years. So I would say if you're not talking about things like ScoliSMART, they unfortunately haven't changed much. I would say one of the big things, surgically speaking, is the idea of vertebral body tethering, which we very often refer for in kids who are refractory to treatment or their curve is to a degree that tethering just makes more sense. And I think on the conventional side, that's probably the biggest thing. On the exercise side, really I think ScoliSMART's the biggest thing that's different. I mean, when you look at other methods like the Schroth method and things, the Schroth method has been around since World War II. So, I mean, it's not exactly a new thing. I mean, it might be newer here in the United States, but, it's really not a new technique. I think really what's made us different, especially in the last even 3 to 5 years, is the emphasis on trying to stop the condition from happening altogether. Right now we're in the process of developing some testing that can try to help predict whether or not a child who doesn't even have scoliosis has a genetic risk of developing it based on certain genetic variants that can be tested. Likewise, we also have testing that we're working with to predict whether or not somebody with a mild curvature will increase to a point where surgery would be indicated, normally around 50 degrees or higher, to see if that person has a lot of the risk factors to say, is it worth doing a non-surgical treatment for you, or are you still going to get worse anyway? That way we can try to identify the kids who would fail as a result of doing things like ScoliSMART or other exercise methods. And then that way they're not essentially wasting a lot of time and energy. And frankly, it would help our success rate too. I mean, we do have a 13% failure rate to published, and anything we could do to minimize that would be better.
I think that's wonderful because, I mean, I've spoken with parents who are trying to make that decision. They don't want surgery for their child, their teenager. And so I can't even imagine them having to make that decision. I know that, they're going to do everything possible in order to avoid that surgery. But again, like you said, you don't want them to be wasting time either.
Right.
So I think that is very important. I love that you're doing that. So for all of the years that you've been treating scoliosis, do you have a most memorable experience?
I don't know if I could isolate it to maybe one in particular, but I could kind of like a collective group of them too. I do remember a particular child who had a scoliosis secondary to a spina bifida, and he couldn't walk. And in fact, he had arm crutches. I mean, he could walk, but he could walk with arm crutches. And as a result of doing therapy with him for about 1.5 years, he was able to finally take steps without arm crutches.
Wow.
And he regained full bowel and bladder control that he had not had.
Oh, that's great.
And to me, that was kind of a big eye-opener in terms of, wow, this really is making a difference. It's one thing always to, work on somebody who has scoliosis and, on an x-ray, you improve a few measurements. But if those measurement improvements on an x-ray don't translate into anything tangible, real life, sometimes it can make you wonder, what are you really offering that person?
Right.
So that was kind of the first big one for me that said, okay, this treatment really did something for this little boy. So that was a big one for me. But then also, honestly, with the suit, I'm still kind of amazed at the people who, not only the people we've helped here, but the people that I see in the Warriors group who went to a fitting center and I've never even met the person, and they have a suit and they're able to do all these kinds of things that they frankly probably shouldn't have been able to do prior to putting one on. And they're, and there are people even recently that you guys have worked with that have, I read what they wrote on Facebook and I'm just blown away. It's actually quite humbling to say, how is it that, this combination of neoprene and Velcro can do what it's doing for people is, really amazing. So it's a very cool experience to be going through, for sure.
Definitely. So for all of us fighting scoliosis, do you have any words of advice, encouragement? Do you have a favorite quote?
My favorite quote, actually, is one from Eleanor Roosevelt. And that quote is, "Nobody can make you feel inferior without your permission." And I apply that to a lot of things. I apply that to myself professionally. The sad reality is, for as advanced as I think we are as ScoliSMART clinics, the fact is we are chiropractors, and that has a certain stigma with it in our society presently. So,
right.
It's one of these things where I can remember the four of us went to a lecture that we were invited to go to by an orthopedic surgeon at Princeton. And, they introduced us as, the four, most advanced chiropractors in the United States. And it really shouldn't be that way. It just be, we have ideas. I don't care what your title is. We need to be applying these things regardless of who created them. So that's one way. But also from a patient perspective, a lot of kids come in here with a lot of, they have kind of like low self-esteem issues, or I hate to say depression because it's not really to that stage, but a low mood issue kind of a thing, where they're self-conscious of their curve or maybe how their torso looks, things like that.
Definitely.
And in this day and age where bullying is such a problem all over and so forth, one of the things we really try to focus on is making sure that the child knows that there's nothing wrong with them. This is a condition that unfortunately you didn't ask for, and we're going to do everything we can for you to help you accept this on all levels. Because, frankly, anymore, everybody has something wrong with them.
Right.
You just can't always see it. You know what I mean?
True.
So I feel like once you can kind of get in your own mind that, hey, I'm not going to let anybody offend me. Whether you're 10 years old or 40 years old, life gets a lot easier that way. And I think in all of the research that's out there, in fact, there was a paper just published here at the end of last year where they were able to show that children who have scoliosis have lower mood, they're more introverted, they have all these, self-esteem aspects. And that had never been published before, even though it seemed very obvious to a lot of people. And that's important because back in 2012, I presented a paper on that to ScoliSMART. And what was interesting, and one of the things that we found, of course, was low serotonin levels in children with scoliosis and so on. And I remember one of the doctors stood up to ask a question to me, and frankly was very smug about it, and said, well, if they're low in serotonin, how come they're not all depressed? Well, guess what? Come to find out in 2017, maybe they do have that trend happening. And now we actually know that from a published perspective. And that's, somebody I don't even know published that information. Maybe I was just 5 years ahead of the game in that regard. But
Right.
Now I think people are starting to come around on board to that look, this is an entire problem that we have to work on, not just a spine curve. And the more people that start to accept that,
Right.
We can then really move into the stages of preventing, not just treating.
Yeah. And I think it's really important because I think even today, a lot of people are getting misinformation and they're not being presented with all of their options. So I think it's important as a whole to get the word out that there are other options for you, and there is a better way to treat scoliosis. We appreciate you, the work that you're doing, and really being an advocate and searching for those better ways to treat scoliosis. And I appreciate you doing this interview today.
Sure, well, thank you.
If you want to find any information or contact Dr. Mark Morningstar, you can go to www.treatingscoliosis.com. Have a good day.
Bye.
Thank you for joining us today. And don't forget, you can find us on YouTube under ScoliTalk. And don't forget to subscribe so that you're notified about future episodes. You can also find us at www.scolitalk.com. Have a good one.